When it comes to treating acne, there's many different treatments that can be done. You can consult your professional esthetician that can do a variety of light peels as well as dermapen or microneedling for you. And then of course you can go to your dermatologist or your GP that can recommend topical ointments containing things like benzoyl peroxide that kills the bacteria, puts oxygen into the pore, dries out the excess oil. Retinoid creams where there's an active form of vitamin A to actually also get rid of the excess oil, get rid of the dead skin cells, working on the 5 contributing factors of acne. Or they could give you medication like Accutane or Accutane, which is something that you take internally at a high dose or a low dose, short period of time, long period of time, depending what you need. If you consult a professional skincare therapist, I recommend that you go to someone that really knows the skin, that's got a proper, thorough knowledge of the mechanisms of the skin. Now, for me personally, I love to treat acne skin. I love extractions. So everybody that comes to me, whether you're having a superficial peel or a deeper peel, I always include extractions. But there's 3 things that we can do for you. We can do a light superficial peel with no downtime, and I love to use something that's actually in a clay base. It's a white clay or a white mask that I put on your skin. It's got a glycolic acid in of 30%, it's got a salicylic acid in, and therefore it actually gets rid of the dead skin cells, it absorbs the excess oil and treats you. You normally need to do 1 every 2 weeks for 4 sessions, and then we go on to a monthly interval. Because remember, acne is a long-term skin condition that you're going to be experiencing. So we have to look after that skin. With the right home care, you're going to get really, really good results. If it is more severe case of acne, I like to recommend a TCA or trichloroacetic acid, and I normally work with either a 12% or a 15%, and then I can go higher to an 18, 20 and 30 depending what it is that we are treating. With your TCA or trichloroacetic acid, instead of going and dissolving the bonds in between the cells and just mopping up the oil, it actually goes to the damaged skin cells and it literally coagulates the protein, and therefore you will have visible downtime. So for 3 days with my TCA, my clients will peel. Normally starts around the mouth and then the forehead, and the whole face will then peel. You can apply makeup, but it doesn't really hide the flaky skin. So I would suggest that you just use the post-peeling care product that I give you, which is an SPF of 50 with vitamin K complex to just speed up the healing, with glycoproteins that makes new cells much, much quicker, with the vitamin C, with the vitamin E. It really nourishes that skin. So I will not do a TCA or a deeper peel on someone that is not going to invest in the K-Sutic. If you can't invest in the K-Sutic, then I will definitely go with the much lighter peel that's got no downtime and that has got specific aftercare, but it's quick and easy. If it is a case where it's really severe acne, there's a potential of scar tissue, or there might already be scar tissue, then the dermapen or the microneedling or derma roller, that's normally what we're looking at. And really what this is it creates a little hole in the skin with needles, and the head of needles could either have 9 needles, but sometimes up to 24 needles. We numb the skin, we clean the skin, you get a new needle obviously every time it's opened up from the manufacturer overseas, and then we start the needling process. I like to needle from the forehead right down to the neck at least, and then I spend extra time on the area where there is the scarring. On the sore inflamed pimple, it will be a little bit more tender, but really fantastic, because with that little hole that we're making, we're starting the process of healing. So chances of a scar to form afterwards is far less. That's really great procedure. But I also needle with a nice sterile solution or a serum to also get active ingredients into that pore and kill that bacteria, get rid of the dead skin cells. And then of course, if there is a pussy pimple, it's yellow or white, then we actually pierce that pimple, we get rid of that pus, but we also get oxygen into that pore that kills the surrounding bacteria at the base of the follicle. Normally with the microneedling or the dermapen, what we do is we do a treatment a month. So every 4 weeks I see my acne clients, and then we do at least 4 to 6 treatments. So over a period of 4 to 6 months, we are going to be treating your skin actively. Sometimes I might follow the needling with a TCA application afterwards, depending on the skin. But basically what I want you to know is that there is something you can use for acne, whether it is consulting a dermatologist and getting a topical cream or an ointment that's more medicated, or getting medication that you take internally like an antibiotic, a contraceptive pill, or Accutane. Or if it is that you go to a professional skincare therapist where we do extractions, we do either a superficial peel or a medium depth peel depending on your acne case. And we can also do some derma needling or derma roller or micro needling if you want to. So you don't have to walk around with a skin that's full of breakouts and acne and pimples. There are great solutions for you.